I liked cardiology pretty early on in my training process. It's a often exciting and ever-changing and evolving field of medicine. There's opportunity to really help people, really make a difference, sometimes even life-saving differences. You really have a lot of opportunities to make positive impacts in people. There's also a lot of variety. Really, we get to run the gamut of the opportunities in medicine. I was attracted to William Newton Hospital in Winfield because it's a great community. I believe that people take a lot of pride in their city as well as the hospital here. They have a great commitment to healthcare and to this hospital and are really devoted to helping it thrive and maintaining a good service to the people that live here. There was already great staff in place, from physicians to nurses to all of the technicians and people that help and work in the hospital. So it seemed like a very welcoming place. I have lots of hobbies and things I like to do outside of work. I have 3 relatively young children, so I'm very involved with their lives and their school and all of their various activities. I like to do things outdoors. I like exercising, fishing, hiking, hunting, biking, that type of thing. I enjoy cooking. I'm a pretty big sports fan, so I'm a fan of several of the kind of local sports teams. Interventional cardiology is a subspecialty. I explain it often to people that we're sort of like the plumbers of cardiology. So we specialize in endovascular procedures, which means procedures where we work primarily inside the blood vessels like veins and arteries. It could be thought of as minimally invasive ways of accessing the heart and the vascular system. The cardiac catheterization lab here is an amazing facility. It's all brand new, it's state-of-the-art, as good if not the best of any heart cath lab in this area. The staff is very experienced and they previously worked together, so they were already functioning as a team. And so I believe that we are really able to offer state-of-the-art procedures and care in our brand new heart cath lab. The focus of the practice here is really to provide a great service to the community and allow people to get the majority of their cardiovascular care close to home with familiar faces in a familiar setting. The goal is always to really provide top-notch, state-of-the-art care for everyone. I think when people visit our office for an appointment as well as for a procedure, that they can expect to be treated very well. I think that everyone from the staff that greets them, to myself, to the people when they leave, I think that they should know that they're going to really receive, I think, the best care that can be provided. It is very, very important to me that people have an understanding what is going on with their body, what we can do to help them, and them also really understanding why we are doing what we are recommending. So communication with patients is really, really important. I also really try to get to know my patients. One of the great things about cardiology is we do have an opportunity to see them long-term, oftentimes for years or even decades. So really trying to get to know people and establish a relationship and earn their trust. I just want the community to know that I'm very excited to be here and be a part of the cardiology team at William Newton Hospital. And I'm very much committed to being here long-term and be a regular face and a regular fixture here in Winfield.